History of orthodontics. So let's start our topic with introduction. Orthodontics is branch of dentistry that deals with diagnosis, prevention, and correction of malocclusion, that is improper alignment of teeth and jaws. History of orthodontics reflects humanity's long-standing concern with dental appearance, function, and facial aesthetics. From ancient attempts to straighten teeth to modern high-tech treatments, orthodontics has evolved into a sophisticated and highly specialized field. Early history is ancient times. Ancient times include ancient Egypt, ancient Greece and Rome, and then is Middle Ages. Ancient Egypt is 3000 to 500 BCE. In this, mummies show evidence of crude attempt to straighten teeth using cords and metal bands. The second is ancient Greece and Rome. Hippocrates and Aristotle describe methods to correct dental irregulation. Dental wirings included observation about tooth eruption, crowding, and malocclusion. Then there are Middle Ages, in which there is little progress. Dental treatment was rudimentary and focusing on extraction rather than alignment. Then there is 18th century development. That is when early orthodontic techniques evolved. Pierre Fauchard, was known as the father of modern dentistry, described the use of a device called a bandeau to expand the arch and straighten teeth. Anthony Bourdain advocated extraction of teeth to correct crowding. Materials that were used in 18th century were early orthodontic appliances that were made up of gold, silver, and ivory, and arch wires that were crude and lacked standardized methods of application. 19th century progress. In this, there were advancements in appliances. As 19th century, there was development of wire appliances for tooth movement. In 1840, Chaplain A. Harris wrote about malocclusion and preventive care. Key figures in 19th century include Norman W. Kingsley, that developed facial orthopedic appliances and advocated early treatment of jaw deformities, and Edward H. Engel, who was known as father of modern orthodontics. He developed the first classification of malocclusion and standardized orthodontic appliances and techniques. 20th century development. It includes standardization of orthodontics, that was by Edward Engel, that established the formal orthodontic school in the US. He introduced appliances like edgewise appliance, which became the basis for modern braces. Second is material and methods, that is introduction of stainless steel wire improved durability and effectiveness. Elastics and brackets allow precise tooth movement. Third was radiography, in which X-rays were used that allowed accurate diagnosis of dental and skeletal malocclusion. Sphelometric analysis in 1931 enabled measurement of skeletal and dental relationship for treatment planning. Functional appliances were developed to correct jaw discrepancies in growing children. It included devices like activators, twin block, and functional regulators. Late 20th century to present, there were advances in material. For example, there is use of nickel titanium wire which shaped memory for efficient tooth movement. There was clear ceramic and plastic brackets for aesthetic purposes. Second was invisible orthodontics, that was introduction of clear aligners for removable, nearly invisible treatment. Third is digital orthodontics, that is computer-aided design and 3D imaging improved diagnosis and treatment planning. Digital scanner and 3D printer appliances allow precise customization. Fourth was temporary anchorage devices, that was small implants used to provide stable anchorage for difficult tooth movements. Key milestones in orthodontics. First is in 1728, that is when Pierre Fauchard described the bandeau. Second was in 1819 when Norman Kingsley developed facial orthopedics. Third was 1877 when Edward Engel pioneered modern orthodontic classification. Fourth one is 1928, that was Carr's introduction of edgewise appliance. Fifth was 1931, that is sphelometric radiography was introduced. In 1970s to 1980s, functional appliances and night-type wires were introduced, and in 1990s to 2000, clear aligners and digital orthodontics emerged. Conclusion of this lecture video. History of orthodontics is a story of gradual evolution from primitive method to highly precise evidence-based treatment. Innovation in appliances, materials, radiography, and digital technology have transformed orthodontics into a sophisticated field that impress body function and aesthetics. Understanding this history highlights the scientific and clinical advancement that allow modern orthodontics to provide safe, effective, and patient-centered care. And this was all about history of orthodontics. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.